From VOA Learning English, this is the Health Report. The World Health Organization says there has been an increase in the number of children in developing countries who weigh too much. In African countries, the WHO says the number of overweight or obese children is 2 times as high as it was 20 years ago. Around the world, about 43 million children under the age of 5 were overweight in 2011. Doctors use height, weight, and age to measure whether a person is underweight, normal, overweight, or obese. Overweight and obese children are more likely to become overweight and obese adults. They are also at risk of developing health problems like diabetes and heart disease. Francesco Branca is the director of the WHO Department of Nutrition for Health and Development. He says governments should consider providing vitamins for children, and they should have policies on how food is marketed to children. But reducing the number of overweight children will not be easy. The goal is difficult to meet, even in wealthy countries. Experts say lowering obesity rates is especially complex in countries that also have high rates of infectious diseases. But the WHO has some basic solutions. The organization says people should eat less fat, sugar, salt, and processed food. This can be replaced with more fruits and vegetables and increased physical activity. These goals are especially important for children. The WHO also says mothers should breastfeed their babies for at least the first 6 months if possible. The current goal for the WHO's World Health Assembly is to prevent any increase in the percentage of overweight children in the next 12 years. For VOA Learning English, I'm Alex Villarreal. From VOA Learning English, this is the Health Report. A top health expert warns that the world needs to deal with what he calls the first Ebola epidemic the world has known. Tom Frieden, director of the U.S. Centers for Disease Control, spoke to reporters at the CDC headquarters in Atlanta, Georgia. He warned that the Ebola outbreak in West Africa could spread widely. He said a huge global effort is needed to contain the disease. Dr. Frieden just returned from a visit to the most affected countries, Sierra Leone, Guinea, and Liberia. He said Ebola cases continue to increase quickly, even though healthcare workers are working extremely hard against the spread. News reports say the number of cases is more than 5,000. Dr. Frieden warned that there is a window of opportunity to stop Ebola, but he added that window is closing. The CDC chief said the Ebola virus is spreading in 2 ways, from patients to caregivers and through unsafe treatment of the dead. Dr. Frieden warned that each day's delay
in dealing with the Ebola spread makes it more difficult to stop. The CDC director said resources, technical experts, and a worldwide organized and unified plan are needed. He said Ebola is not only an African problem, but a world problem. U.S. health officials have announced an agreement with a California-based drug maker, MAP Biopharmaceuticals. The deal calls for the company to speed development of the experimental Ebola medicine ZMapp. ZMapp has not been tested on humans, but 2 American medical missionaries who had Ebola were treated with the drug and recovered. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. Is chocolate good for our health, or does it just taste good? Many experts warn that the sugar in chocolate is not good for us. But doctors say there are also healthful substances in chocolate, like antioxidants. Some experts say uncooked, pure chocolate may contain just the right balance. The biggest value in eating cocoa and dark chocolate may be their ability to lower blood pressure. This comes from the experience of cocoa butter melting in your mouth. That happy feeling may also add to chocolate's antidepressant qualities, says Kim Hoffman. Ms. Hoffman is a dietitian, a person who advises people about healthy eating. She says the phenethylamines in dark chocolate make us feel better. Phenethylamines are also naturally produced by the brain. She says they create a happy feeling. But not all chocolate is equal. The process of producing chocolate affects its health benefits. The heat required to process most chocolate can be as high as 130 degrees centigrade. Some researchers say such high temperatures can actually lower the effectiveness of chocolate's healthful chemicals. Business owner Anthony Grid makes chocolate at his store in Cape Town, South Africa. He keeps the temperature of his uncooked chocolate below 42 degrees. He says many food experts support lower cooking temperatures. Chocolate makers can also decrease healthfulness by adding sugar to cocoa. That reduces the amount of the antioxidant polyphenol in cocoa. And as food science writer Leonie Jobert notes, sugar is connected to weight-related disease. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Technology Report. An insect with an extremely unusual ability to hear is the model for what may be the future of hearing aids. The insect, a fly, behaves like a parasite, an organism that lives on or in another organism called a host. This exceptional fly places larvae
a young fly onto a cricket host. The larva digs into the cricket and eats the insect from the inside out. The yellow fly is native to Central America and the southern United States. It finds its larva host by listening for the cricket's sound. The fly's strong sense of hearing can direct it to a cricket even 100 meters away. But the insect's ears are just 2 millimeters apart. That is so close that sound should reach each ear at almost the same moment. This would make it difficult to find where a sound came from. But the fly also has a tiny structure between its ears that creates pressure to slow down the sound waves. This permits the fly to identify where the sound came from. Neil Hall is a sound engineer at the University of Texas. He and his team of researchers created an electronic hearing device. The team made a silicon copy of the fly's ear structures. They used materials that can turn mechanical pressure into electricity. The device requires little power as a result. This means it would be less costly to use. Mr. Hall says the device could improve hearing aids in the future. He says it also could have military and defense uses. But he says more research and development work is required. In July, the journal Applied Physics Letters published a report about the University of Texas research. For VOA Learning English, I'm Carla Babb.